Your feet might be sending you emergency signals about your blood sugar right now, and you don't even realize it. From strange numbness to subtle skin changes, these symptoms often appear early but are dangerously ignored by millions. In the next few minutes, I'm going to reveal 9 critical signs that you must never overlook. Most people believe diabetes can only be detected through a lab test, and while blood work is vital, your body starts shouting warnings long before a needle ever touches your arm. The very first place your body speaks? Your feet. I'm Dr. Ben, and as a specialist in modern health for the 50-plus community, I've seen too many patients end up in the ER because they ignored these silent alarms for months, or even years. Today, I'm going to change that for you by showing you exactly what your feet are trying to tell you. The first sign is something almost every patient has experienced but dismissed as a normal part of aging: tingling or numbness. You know that feeling when your foot falls asleep? If that happens regularly without a clear reason, we need to talk about what's actually happening. High blood sugar acts like an acid that slowly eats away at the protective coating of your nerves, a process called peripheral neuropathy. Imagine your nerves as electrical wires. When the plastic coating is damaged, the signals get scrambled, creating that tingling sensation. Research shows this affects nearly 50% of people with high blood sugar. My recommendation? Start a 20-minute daily walk, not a jog, just a walk, to keep blood flowing to those extremities, and cut back on added sugars starting today. Sign number 2 is perhaps the most distressing because it strikes when you're trying to rest: a burning sensation in the soles of your feet at night. Many attribute this to being on their feet all day, but when your feet feel like they're on fire while you're lying down, your nerves are sending a false distress signal to your brain. It's like a smoke alarm with a faulty sensor going off when there is no fire. Studies in diabetes care found that this burning often appears 1 to 3 years before a formal diagnosis. To help, drink at least 8 glasses of water daily to help your kidneys flush out excess glucose, and add more fiber to your meals to slow down sugar absorption. The third sign is truly dangerous: slow healing wounds. A small blister or a cut from a shoe should heal in a few days. But when your blood sugar is high, your blood vessels stiffen, preventing oxygen and nutrients from reaching the wound. It's like trying to water a garden with a kinked hose. The water is there, but it can't reach the plants. According to the CDC, ignored minor wounds are the leading cause of non-traumatic amputations. Tonight, after your shower, check your feet. If you see a cut that hasn't improved in 48 hours, call your doctor. Not next week, 48 hours. Sign number 4 is hidden in plain sight: skin discoloration. Have you noticed your ankles becoming darker, deep red, or even slightly bluish? This isn't just sun damage. When circulation is compromised, your skin isn't getting enough fresh, oxygenated blood. This distress signal can be detectable up to 18 months before a diagnosis. Try 5 minutes of ankle circles and toe lifts every morning to get that blood moving. The fifth sign often surprises people because it seems so minor: chronically cracked heels. You might think it's just dry skin, but if lotion doesn't help, it could be your autonomic nerves. These nerves control your sweat glands. When they are damaged, your feet lose their internal moisture. Deep cracks are open doors for bacteria. Hydrate with coconut oil every night, but never put it between your toes, as trapped moisture can cause fungal issues. Sign number 6 involves your kidneys: persistent swelling. If you leave deep sock marks on your ankles every evening, your kidneys might be struggling to balance fluids. This pitting edema is a sign the filtration system is under pressure. When resting, keep your feet above the level of your heart and significantly reduce your salt intake to prevent water retention. The 7th sign is sharp, stabbing pain often mistaken for arthritis. While ibuprofen might mask the pain, it won't fix the underlying nerve dysfunction. Damaged nerves can become hyperactive, screaming at your brain like a car alarm that won't stop. Gentle foot stretches and a 3-minute massage every evening can help soothe these hyperactive nerves. Sign number 8 is having cold feet, even in the middle of summer. If your feet are icy under 3 blankets in July, your pipes or blood vessels have narrowed so much that warm blood can't reach the end of the line. A brisk 30-minute walk where you swing your arms is the best way to force circulation back into those cold extremities. Finally, sign number 9 is one almost no one talks about: the loss of hair on your toes and lower legs. Hair follicles are like tiny plants. When the irrigation, your blood flow, stops, the plants die. If your legs have become unusually smooth or hairless, it's a visible marker of vascular damage. I've shared these 9 signs because I want you to stay proactive. You've worked hard for your independence and your health. Don't let high blood sugar take that away. Tonight, take just 30 seconds to look at your feet. If you see anything concerning, please call your doctor tomorrow. I care about your journey, and I want to hear from you. Have you noticed any of these signs? Type yes in the comments if you have, or ask any questions you might have. If this was helpful, please like this video and share it with a friend or family member. You might be giving them the information they didn't know they needed. Don't forget to subscribe and hit the bell icon so you never miss our weekly health conversations. I'm Dr. Ben. Stay vigilant, stay proactive, and take care of those feet. I'll see you next video.